Legs are a little more, it's not that the leg splints are hard to do, it's that your choices are basically posterior, include or don't include the foot, and then a U splint, right? It's the issue with leg splints is when to do what and how to avoid a heel sore. So, so the ones we see, and the ones you guys probably see the most are toddler's fractures, right? So tibia fractures. Boot those. If it's a true toddler's fracture, put a boot on first. That's your first choice, okay? And if you need to splint it, you can.
A toddler's fracture is a distal tibial fracture that's not displaced.
Toddler's fracture? Yeah. Or even just by exam, you know, tender on the diaphysis where their x-ray is normal. So, if you have a tibia shaft fracture that's just a crack, it's more than a toddler's, but it's totally stable, non-displaced. Try to treat those with just a stirrup splint, okay? Try not to put anything behind the heel with those until kids are about 12 or 13. And the reason why is they get these posterior splints behind the heel, get these terrible heel sores unless you're really, really, really careful about keeping their ankle at 90 degrees as you're putting it on. And even then they can still get it. And kids who are younger aren't able to verbalize that the pain they're feeling is coming from a heel sore that's starting versus the fracture, right? And it's terrible. So we're doing an initiative with IHC right now to try to have the urgent cares around the valley learn to put splints on. But I just think in any way that you can stay away from doing a posterior behind the heel splint, you should do it. So proximal tibia fractures on the trampoline, you guys see that? Yeah, go ahead.
Just a question, I don't know if it's dumb or not. We have a lot of like boots that we can put, you know, kids with toddler fractures in. Could you comment on like the benefit of a splint versus a boot? If one for
Boot is better.
Oh.
Yeah, absolutely. Yeah. So, and there's great data actually coming out that boots are fine, but actually doing nothing for toddlers fractures turns out to also be fine. So there's 3 papers that have come out in the last 3 or 4 years that show nobody displaces, everybody limps for about a week and a half, and then ultimately they do fine. So if you can also ignore a toddler's fracture and it turns out to work.
The slides that Mitch sent today from Dr. Splints go like talk a lot.
Yeah, I was trying to.
From your aid.
Yeah, I was trying to get everybody in that audience on board. They're like, yeah, no, it does. I will tell you, having done it a few times, it takes a little bit of hand holding to talk them into doing nothing. But the parents that have done it have been happy, actually. So let's pretend you're a 6-year-old with a mid-diaphyseal crack in your tibia that's not really a toddler's. But we're going to do just a sugar tongue splint, okay? Grease sock is doubling for the padding that you would put in there. Yeah, if you have a boot or a brace that fits anything that is indicated for that, use that first, for sure. So a U-splint or a sugar tongue below the knee is just this. And again, I'm going to trim it. So, but you want to make sure it ends, you know, here's the tibial tubercle. So right about there, maybe a little bit below, but you don't want it to be too low, especially if it's a mid-shaft tibia, right? You want it to come up high enough that it's getting the lever arm that you need. You also want to make sure it comes out and your heel is free. I don't know if you guys can see that back there. So you're not putting this behind the heel. You're using this to keep the foot up. And so as you're putting it on, you want your person who's holding to make sure they keep the foot neutrally dorsiflexed.
Is that what you meant by float the heel?
Float the heel means they don't let the heel rest on anything when they go home. So it's an instruction to the family. So when you're in bed, you put pillows behind the leg, leave the heel free. Yeah. It's also an order we put in inpatient orders for nurses to make sure they float the heel. Trauma patients especially will get heel sores because no one's paying attention to the splint on their leg, you know? They got so much else going on. Okay, so that's basically it. And again, if you use a big, so if I'd used 4-inch on her, that's where you're gonna get more wrinkle of the fiberglass, right? 3 inch is a good size for her, and it is for most kids. Little kids, you can use 2-inch. So, I mean, that's pretty straightforward. What else can you use this for? Ankle sprains. If you don't have a boot, you can use it for distal fibula fractures if you don't have a boot. Ankle fractures that need a little more stability is where this gets a little bit interesting, because you do need something a little bit stronger behind the foot, usually. If you need to add a posterior splint, just make sure their foot is at 90, the ankle's at 90, and make sure you don't over pad the heel, right? If you have a ton of padding, like 8 layers of padding behind the heel will actually move more than if you just have 3 or 4 layers. So not over padding is one of the messages here, okay? So if I were going to do that, I would and you can either do below the knee or above the knee. So if you have a more proximal fracture up here and you'd really like to mobilize the knee, you can add your second piece starting above the heel and going up to the back of the thigh. So that's for like a proximal tibia fracture. But if you really just need to immobilize like a Salter 2 distal tibia fracture, it's just fine to go below. You just got to make sure their heel isn't over padded. So you're going to go place where you really get into trouble with a heel sore and splint material is if there's too much padding, but also if they're not at 90. So if they're plantar flex to begin with in the splint, it allows motion, and that's where the back of the heel starts to rub against the material, especially when they're in bed and their heels hitting the bed. Does that make sense to you guys? So you could just add this right like that and put the A-strap behind it. Just make sure it's centered. So I would do this, and then I'd put the A-strap on and do the whole A-strap on top of the whole thing.
One A-strap on top
One
of
A-strap
both.
on top of the whole thing. I'm just showing you just in case you wanted to add it. And again, the wider stuff you use, the more likely it's going to wrinkle around the sides of the ankle. But it turns out not to be as big of a problem as you think. So, okay, we just do one posterior splint.
Okay.
Starting high, you don't want to end here, that's bad, right? So start high and bend their knee about 30 or 40 and end right at the Achilles. And that's plenty for that. Yeah.
For a proximal tibia.
For trampoline, proximal tibia fractures. Yeah.